Hello and welcome to a brand new series here on Orion Neighborhood Television, Lansing Update. I'm your host, Katie Shimatero, and today I'm here with the State Representative Brad Jacobsen. Thanks for joining us.
My pleasure. Happy to be here. I look forward to doing this and trying to give people of the Orion area an update on what we've got going on in Lansing.
Wonderful. Real quickly, just give us a brief background. I know you have a big family history here in Lake Orion. Just for viewers that may not know,
Sure.
Give us a quick.
Sure. Well, been around Lake Orion a long time. Jacobsen's Flowers here in Lake Orion is our family business. My great-grandfather started back in 1920. So here 95 years we've been in business here in Lake Orion. I live in Oxford, grew up K through 12, Oxford schools. Went to Michigan State, took political science, economics, business classes. Had thought about either being a history teacher or a lawyer, but after 4 years of college, decided to come back and work at the family business at the flower shop. And shortly after that, I was elected Oxford Township trustee. I served on the Oxford Township board for 16 years. Was elected Oakland County Commissioner, served 4 years at that. And I've just finished my second term, 4 years at the legislature in Lansing as state representative, and we're just starting my third and what is my final term because of term limits.
Oh, okay.
So served in a whole variety of different capacities. I was DDA president here or chairman rather, in Lake Orion for a while. I chaired Water and Sewer Committee in Oxford for many years. I've served on police and fire boards. Really done a whole lot of public service and really enjoyed it.
Wonderful. Yeah, you've definitely done a bunch of stuff, and you've really, you've given a lot to this community. I know your family, like you said, have been in here for what, 95 years?
Well,
that's crazy.
We actually go back on my grandmother Jacobsen's side. We were related to the Goodisons that Goodison is named after, and Grandma graduated from Oxford High School in 1916, I think it was.
Wow.
So, yep, been around a while.
Extensive history here. Wonderful. And you've done a lot of good as our state representative, and we have a lot of talking points to cover today. So let's go ahead and start with something that's been getting some publicity in the media, the new proposed changes to no faults.
Yeah. Auto no fault is sort of a recurring subject in Lansing. It was started back in the 90s. Many people don't really know what exactly it is. So real briefly, in Michigan, if you have a car accident, your insurance company covers the repairs to your car and your medical needs based on your insurance. No fault being, doesn't matter whose fault the accident is, your insurance is the first payer for those. And it was done in part back in the, let's say in the 90s to cut down on the number of lawsuits that were, at the time, apparently, and it was before I was really involved with anything on it, but it's my understanding the court system was quite bogged down with lots of legal cases, and it was decided that having your insurance cover it makes more sense, makes things more efficient, and would get the victim, the injured person in the car accident, get their car fixed quicker and get them their medical benefits quicker. So as such, Michigan was set up with what's considered to be probably the most premium auto insurance in the country, in that if you are injured in a car accident, particularly catastrophically injured, you're quadriplegic, you're bedridden, you need multiple surgeries, closed head injury and such, that you have unlimited benefits. You will get, if you need a motorized wheelchair, if you need a specially equipped van, if you need 24-hour health care, you will be provided that under our insurance policies. The flip side of that is we also have some of the most expensive insurance in the United States. Not just because of health care, part of it, but also we have quite fairly high incidence of theft and what's referred to as comp and collision. So our actual physical car damage is higher than some other places in the country.
Okay.
And our auto insurance, or our health insurance part of it's a little higher also.
Okay. So now, what are some of the changes that are looking to be made? I know you mentioned possibly savings. What is the average person paying for insurance? And if this proposal passed, what would it be lowered to?
Well, that's a tough question, because really it's very difficult to come up with even what you would call an average price for auto insurance.
Oh, okay.
In Michigan, they estimate that 1 out of 5 drivers do not carry any insurance whatsoever. Now, you have to have insurance to get your license plates. Mm-hmm. So there are a number of companies out there that will write you a policy for 1 month or 3 months. So people go out and they'll get car insurance for 3 months, get their license plates, and then let their insurance lapse and drive without it. If they're in an accident and they have a health injury, the vast majority of those people still will be covered with full health benefits, even though they don't carry their insurance.
Okay.
But their cars may not get fixed. So it's very difficult to come up with an average. It's probably somewhere, if you're in the outstate area, say north of Bay City, Saginaw area and such, you might be looking at $1,100 to $1,300 for your car insurance. As you get down into the more congested metropolitan areas, your insurance goes up. Typical around probably North Oakland area might be as much as $1,400 to $1,700. Okay. Also, depending on the factors of your age, if you've got a teen driver, you pay more. Your value of your car, there's a lot of variables go into it. The savings under the new proposal is part of the arguments that are going back and forth about whether we should make changes or not. We have one faction, which is the insurance companies, who would like to make changes, particularly on how much they pay for certain treatments. Not do away with those treatments, but try to adjust the rate that they pay for them. Mm-hmm. Then on the other side, you have the healthcare providers, the hospitals, rehabilitation clinics, companies that provide in-home health care, who are concerned that the changes that the insurance company wants to make may reduce their revenues, if you would, and a lot of them are having trouble finding people who will actually go into a home and take care of a person who maybe is bedridden. If you think of some of the unpleasant things you might do with an infant, unfortunately you might have to do those with a 150-pound gentleman.
Yes.
So, bathroom items, washing, just physically moving them around, getting them in and out of bed, in and out of their wheelchair and such. And there's a concern that if the rates get too low, they may not be able to provide those services. For the hospitals, there's a concern that right now some rates are relatively low. If you're under Medicaid or Medicare, the hospitals say they're getting paid less than what it actually costs for that service. So they're making it up somewhat on the cost of auto insurance. One of the typical things that's always looked at is an MRI, or the body scans. The hospital may charge auto insurance maybe $3,000 for that test, and under workman's comp it might be a $700 test. Huge differences. A little tube of ointment that you might buy at a local pharmacy for a couple of dollars under work comp might be $8, and under auto insurance might be $17. So those are the things the insurance companies are trying to change. And all of this sort of goes into a big mixing bowl, and from that we try to figure out, is it worth making those changes? What effect it's going to have on the patient? What effect it might have on all of our rates, and is there really going to be any savings? Right now, the estimate is that for the first 2 years, the insurance companies have promised that they will reduce rates by $100 per year for the first 2 years. So $200 savings total. Try to balance whether that's a good value considering what might be potentially given up on the other side.
So now, this the no faults policy that we have right now was passed back in the 90s, and have as drivers, the money that we've been paying towards no fault, has that been going to kind of a pooled area that, like you said, with the is that part of the MCCA? That
Correct.
Okay, so now with the changes, is there any changes with that? Will the money be going to different areas now, or will it still be going to people that are disabled during car accidents? How does that work?
Well, in spite of some of the ads that have been appearing on TV, yes, it will still go to the people who are injured.
Okay.
There's both sides are doing advertising campaigns right now and doing what are referred to as robocalls, a call you might get at your house and says, hey, the evil insurance companies are trying to take away your benefits. Call your state representative, push #1 and tell him what you think. Well, the evil insurance companies aren't trying to take away benefits. And the insurance companies, both sides are playing to people's heartstrings on these things. Right now in Michigan, we pay $186 per year per car on the policy for, goes into a fund, MCCA, Michigan Catastrophic Claims Association. If you're injured, your insurance company will pay up to $545,000 of your first part of your coverage. Most health claims under auto insurance are in the neighborhood of $2,000 to $3,000, $4,000, that range. But if you were to get to that $500,000, your insurance company pays that. Once you get to the $500,000, then the payments roll over into the Catastrophic Claims Fund, the MCCA, which is where all of us pay our $186 this year. It fluctuates from year to year, but it's been gradually going up. A couple years ago, it was $145. So it goes into that fund. There's estimated to be about $18 billion, billion with a B, in that fund. And that fund is used to pay any expenses over that $500,000. So if you have to have constant care, any number of different medical necessities over that come out of that fund. And that's part of one of the concerns is that's been jumping rather rapidly. Next year it is supposed to reduce to I think it's $150 or $156 next year. I say it varies. So with one of the new proposals with the language and things we're looking at in Lansing, and none of this is set in stone. It's all still in the works and being processed and trying to figure out the ramifications of each thing. The proposal calls for the existing MCCA to, I guess I would say, be closed so that only patients who are currently injured under it would be under that fund. Then a new fund would be created, we'll call it MC3 because we really don't have a name for it yet, that would operate very similarly, except the state of Michigan would appoint a commission to oversee that fund. The current MCCA is run by a group of insurance companies. The new one would be run by the state. And the idea with the one with the state is that we would look more carefully at what the claims are for all the thousands of people across the state that might fall under that category. We'd say, okay, we need $800 million this year. So all of our insurance bills would reflect our share of that $8 million. Right now, the insurance companies have to do it differently. It's been explained to me because of their actuarial tables and different things, and that's one of the concerns, is that there's so much money in that fund that we've overpaid into it, and the new fund would save all of us some money by being more careful on how much money we pay into it. So there's some potential savings on that aspect too. But it's really difficult to come up with solid numbers on these things because in part, who knows how many people are going to get injured, who knows what's going to happen to the cost of the insurance. With the existing MCCA, once all of those patients are paid out of the system, under the proposal, the money that might be left in that rolls over into the new fund. So then, say if we were paying $30 in the new fund, maybe we wouldn't have to pay anything for 2 or 3 or 4 years, depending on how much money gets rolled over. But that won't be, until the last patient who's covered no longer needs the service. That might be 10, 15, 20 years. There's no way to know.
Well, it sounds like that was kind of maybe the fear behind this proposal, that money wouldn't continue to go to people that were victimized during car accidents. But it sounds like there is a plan behind it, and the money will still be used for good uses. So I think we have a little bit more to touch on for the proposed changes to no faults. Keep watching Lansing Update. We'll be right back with our State Representative, Brad Jacobsen. Welcome back to Lansing Update. I'm your host, Katie Shimatero. We're here today with State Representative Brad Jacobsen, and we're talking about the proposed changes on no-fault auto. So now, in the first half of the show, we talked a little bit about savings and the MCCA. So now let's get into benefits of this.
Okay, there's a tremendous amount of concern on the hospital side, on the caregiver side, if you will, on the patient side, that their benefits might be reduced, changed, restructured under this. Right now, in the proposals we're looking at in Lansing, there's no call to do any of that. There was a proposal a couple of years ago in Lansing that instead of the unlimited cap, the unlimited benefits we talked about earlier, that there would be a cap that maybe you would only be able to collect up to $3 million or $6 million total. And after that, your benefits would stop and your family would have to pay, or you'd go on to Medicaid, Medicare, some additional service. That is not in this proposal. There's some ads on TV right now that say, oh, my benefits are going to get cut. I won't be able to get my health care anymore, or my care, my treatments. That's not the case. There is an area that we are looking at changing benefits just a touch, and that has to do with what's referred to as family home attendant care. Right now, there are individuals in Michigan who need 24-hour care, and they will have a family member giving them 24-hour care. That wage rate, if you would, hourly, could be just about anywhere on the board. And if there's 2 or 3 or 4 members in the household, there are some cases we've seen where 3 and 4 members of the household are all getting paid 24 hours a day to watch a young man or a young lady, perhaps a child who was injured, and you've got 4 people who are getting paid 24 hours a day to provide services, and they may have no nursing, no training, no skills whatsoever. We are looking at changing that. The proposal right now is for $15 an hour, and I believe there is a cost of living escalator built into that for one person 24 hours in the household. Now, if a doctor and they can justify the need for two people, or if let's say you're a registered nurse also, and your brother is taking care of dad at the $15 an hour, but he needs an IV or he needs shots at a particular time during the day. You as a registered nurse could do that, and you would be paid at maybe $35 or $40 an hour, whatever the going rate for an RN type skill set would be. So we're not trying to, the proposal is not trying to undercut or reduce the level of service. At $15 an hour, 24 hours a day, I'm told it comes out to about $135,000 a year. So you can imagine if you've got 2, 3, 4 people in a household all getting currently maybe $24 an hour, you're looking at families who are pulling in perhaps close to $1 million a year,
wow.
$800,000, $1 million a year. And is that really fair? Is it accurate? And that family attendant care and those problems sort of lead into sort of the final area of no fault that we haven't discussed yet, which is a fraud authority. The discussion is that the insurance companies will pay into a fund. I believe they're looking at $2 per car. Now, we say the insurance companies will pay into it. We all know ultimately it's all coming out of our pocket, whatever they pay. But something to the effect of, I believe it's $2 a car to go into a fraud authority. And the fraud authority will help pay for people to go out and investigate various insurance issues. Not just health care, not just family attendant home care like we talked about, but perhaps there's instances where auto repair facilities will bill insurance companies for a new bumper or new grill or work to a car that they never really did. There's instances where maybe a healthcare facility is billing the insurance company for tests they never actually did or treatments they never gave. So this would allow the investigators to go out, find these problems, look for these problems wherever they might occur in any aspect of the auto insurance realm, gather information, and then turn it over to the local police and or prosecutor's office to try to prevent this from happening in the future. As I mentioned before, out of our auto bill, insurance bill, a portion of it, about 2/3 of it generally, is for physical damage to the car, and about 1/3 is healthcare side. And the numbers change depending on a whole variety of different variables, but that's generally about right. And it's estimated that if we can get rid of the physical car side fraud, that we would all save quite a bit of money on that also. So that's one of the issues. I haven't heard too many people really, listening to the whole debate on this for most of really the last 3 years, but now on the current proposals. Very few people have problems really with the fraud authority as long as it's done on a broad basis so that it doesn't just zero in on the healthcare side of it. If it looks at, maybe the insurance companies, there's complaints that the insurance companies don't pay in a timely manner. If you've had services, sometimes the company says, well, they haven't paid me, it's 18 months since I've gotten a check from the insurance company. Maybe there's some fraud issues there too. So they're going to have the ability to go out and look at all kinds of different things. And ultimately, really the goal is if we can save all of us drivers some money on our insurance and make sure that we protect the health and welfare of our drivers once they're in one of those horrific accidents.
Well, wonderful. We got a lot of information here today. For people that maybe want to find out a little bit more about this proposed no fault, where can people go to get some more information?
Sure. Well, if they wanted to, they could start by looking at the bill, although the bill that's out there is going to be I think, quite drastically changed.
Okay.
So, but it's SB 249, Senate Bill 248 and 249 are the two bills. You can go to the State of Michigan website, look up bills. They could call our office. We have a 800. It's 1-855-REP-BRAD. 1-855-REP-BRAD. That goes right into our office, and we can give them some updates or information on it. There's a couple other, you could contact your insurance company. If you've got auto insurance in Michigan, they're right up and they know all about it. If you wanted to, there's a group called CAP, C-A-P-P. It's terrible, I can't remember what exactly that stands for. And there's one called CPAN, C-P-A-N, or Brain Injury Association of Michigan. B-I-M, I think it is, or B-M-I. Terrible. Should have been. Anyways, Google Michigan No Fault, and I'm sure you'll find something on the internet, or call our office.
Wonderful. Well, we appreciate you taking some time out today and coming and talking with us.
My pleasure.
And that's all the time we have for this episode of Lansing Update. I'm your host, Katie Shimatero, and we'll see you next time.